not ignored, and for being such a strong partner with indivisibles and grassroots activists in your district and around the country. So with that, my question to you is simple. What can Democrats do to make sure there is targeted relief to the most vulnerable?
First, I want to thank Jaleesa, Johnny, and Tabitha for sharing your stories. You really do speak to where our focus needs to lie, where our outrage needs to lie, that you're having sleepless nights for all of the reasons that you very eloquently articulated. We need a bill that puts the people first, that bails out the people, that provides tangible, meaningful relief. And yes, that's what the Democrats need to do, but I just want to underscore that we are only as good as the will of the people. And that's why I'm grateful for this opportunity for us to come together in community today. We're physically distancing, but we can't socially isolate, not only because that's bad for the soul, but because it will impede the mobilizing and the organizing that we have to continue to do to apply pressure. I mean, bear in mind the structural racism and the injustices and the inequities that all of you who are part of this Zoom have been working actively to dismantle your entire personal and professional lives. If we already had universal health care, if we already had paid sick leave, paid family leave and sick leave, think about how we would be better weathering this storm. If we already had universal child care, if people were already working at a living wage. But instead, every injustice, every inequity, every disparity, by the way, that was created by policy, has only been worsened in this moment. And so COVID-19, the coronavirus, didn't create these inequities, but it is worsening them, and rapidly. For a long time, because of the comorbidities of structural racism and unequal access to healthcare, Black and brown folks have been slowly dying. I consider it sort of a political carbon monoxide. And now it's just happening more bluntly. And so it is both metaphorical and literal to say that this is a matter of life and death, and we need to act like it. This is unprecedented in every way. The scale and scope of this hurt and this pain and this trauma and this fear and this loss. And so our response must be unprecedented. The solutions must be unprecedented. When people talk about, and RT, Representative Tlaib and I talk about this a lot, when folks say they can't wait till we can return to normal, no one on this Zoom wants to return to normal, because that normal was unjust and inadequate and insufficient. So we need to continue to push now and beyond this, because we need a complete paradigm shift and a reset. So the things that I'll be fighting for: student debt cancellation. Black and brown communities borrow more because they don't have generational wealth, and they default more. Most borrowers are carrying a minimum of $30,000 worth of debt. So that is one less bill that folks should be worried about. We need student debt cancellation. We need rent and mortgage cancellation. And might I add, not just residential, but commercial as well. Because we won't get to talk today about the hurt that our small businesses, our true small businesses, not Shake Shack, not Potbellies, our beauty salons, our barbershops, our bodegas, our restaurants, the life's blood of our community, who hire locally, who contribute to this economy. So we need, for those businesses, and I won't get into that today, but they need support too. But I'm going to be fighting for student debt cancellation, more money for our community health centers because they serve our most vulnerable, for our undocumented and our immigrant family, friends, and neighbors to be included. They are making contributions in community and to this country every day, and it is unjust that they've been excluded from every relief. What else? Direct cash assistance. I mean, only Secretary Mnuchin and anyone who he shares company and time with thinks that everyday people can live on $1,200 for 10 weeks. That's $17 a day. More support for our food banks, because food insecurity has been the number one issue that I've heard. And I also just want to say, again, rent cancellation, mortgage cancellation. We can't forget that we're 7 days out from the first of the month. And the fact that people are right now living in fear as to whether or not they will live, that they can survive this public health crisis, and also worried about whether or not they can pay the rent is unconscionable. And as I close, I just want to just really ask us to do a couple of things. When we talk about frontline workers, it is not only our heroic doctors and nurses, it is also our home care aides, our social workers, those doing direct care, DCF, those working with the developmentally disabled. They don't have PPE either. It is also our essential workers. And when we talk about vulnerable communities, continue to name our tribal nation, continue to name the brothers and sisters that are incarcerated behind the wall, the immigrants that are in detention facilities, and those experiencing homelessness. So these are just some of the things that I'll be fighting for. And I know that I won't be alone in that. But again, I want to thank Jaleesa, Johnny, and Tabitha for sharing your stories. I've always believed the people closest to the pain should be the closest to the power, driving and informing the policy making. And so you just better make that case today. And so we're going to keep fighting for a bill that puts the people first.
Thank you, Congresswoman. It's really heartening to know that we have fighters carrying these demands and carrying the stories from this